I'm Kim Look with MedMasters, and this is it's designed to be monthly, but lately we've been having it weekly or bi-monthly because we have so many guests and fun information we're just excited to share. We've got a lot of great feedback from you all in terms of it's been helpful to you, so we're so appreciative of the support. But we are MedMasters again, master the art of healing. And we've been spending a lot of time lately on the topic of peptides and human cellular tissue products, because the landscape has changed a lot lately. It's made things different for providers. There's lots of providers that still don't use peptides, and also the conventional, or what do we call it, Suzanne? The like this weight loss craze with using peptides at higher doses, and people, like, you can get them on every corner, it feels like, and you can, I was hearing somewhere, where was this, that you can now get peptides from Costco for like $197.
Wow.
So there's so much going on. We're seeing side effects of misprescribing, or not properly stacking, or at least not properly educating patients on the proper ways to use these GLP-1s. So anyway, we've had this focus on peptides and human cellular tissue products, all leading up to a big virtual event that we have June 7th and 8th. And there's no way we could have this conversation with Dr. Suzanne Ferree coming on and talking with us. And we're so, again, just honored to have you here, and willing to share this information. You've been talking a lot about this cool part of your practice. So again, we're grateful for the time you set aside to speak with our guests and our members at MedMasters.
Thank you so much, Kim. This is fun. I'm glad to get to spend some time with you.
So just real quick, can I was like, can I say this? And then we're live, so I don't know how you tell me no, but I guess I'll ignore that. We'll have to talk about it later. But we first met a few years ago, I think it was at an ACAM conference, where she was asked to speak on different things. And I was kind of learning and coming into the peptide world. And I was there to speak and talk about ozone and UV, as many of you know. And Lexi Yu was there, and Doug Rainey was there. And it was just, I just remember you speaking, thinking, you are talking so far above most people in the room, sharing case studies and how you go about patient care. And it was just a really impressive set of presentations. And then also, you look the part. Like, for me, that is such an impact on a patient, is a provider that practices what she preaches, is you know, practicing the self-discipline of lifestyle and stuff. And so the combination, I was so impressed with you. And it's probably been since then that we really had a chance to meet up. But
yeah, that was a great conference. I really enjoyed the pre-conference talk about ozone with you guys. That was a really fun time.
Yeah, there were so many things that went together with it. We partnered with ACAM at that point too. You're speaking with ACAM or for ACAM again in a couple weeks. I think you've spoken for them every year.
On the 17th is the next one. And this is their 50th anniversary, so it should be really good.
Yeah, obviously like a legacy there with ACAM. We did work with them a little bit again, in that we have a special code. You can get 30% off your ticket with MedMasters 30. Yeah. So if you're here and you want to go to ACAM, you need something to do in a couple weeks, or is it already? Yeah, this weekend's Mother's Day, and then it's the following weekend in Dallas, Texas. But what are you, actually, let's back up. Introduce yourself a little bit. Tell us a little bit about your main scope of work, and then how you got into regenerative medicine.
Sure. Well, a lot of you guys know me as Suzanne Turner, and
that was going to be my question.
I took back my family name a year ago, and so it's now Ferree. It's how you pronounce it, Ferree. And so that might have been confusing, but that's who I am. Yeah, I've been speaking on peptides for a while now, but I started out as a regular allopathic doctor, family medicine back in the day, and I kept seeing patients that were sick, that I knew were sick, but they were not getting better from the standard things, and their labs showed that they were normal. So I kept lurking and looking and looking for what was the next thing. And they would bring me their bioidentical hormones. And I would say, I don't know how to write this prescription, but I would copy the one that was on the label. And the pharmacist said, you clearly don't know what you're doing. So can I send you to a conference? So I went to a conference where I learned how to do bioidentical hormones. And then, oh my gosh, a whole third of those sick patients got better. So that was awesome. I had this whole group of patients that were sick. Their labs looked normal. They were not well. And we fixed them with hormones. But then there was this additional, 30% of my patients that were still sick. And so I kept looking and looking for what's the next thing? How do I fix them? How do I make these people, how do I engage them and get them feeling better? And that's always my quest is finding ways for each of these groups of patients that doesn't get better with the things that we typically expect them to get better with. How do we get them better? And is there a test I'm missing? Is there a diagnosis that I'm missing? Is there a treatment that I'm missing for a known diagnosis? And so for myself, I was a competitive runner, and I got a condition called Trendelenburg, which many of you probably have experienced, where your glutes your neurologic process doesn't turn on the glute. And so you just start running using your hamstrings, and you get this high hamstring strain and a glute sort of deadness, and or not really engaging when you're running. And so you end up with a really bad pain because the hamstring is not designed to carry the weight of that. And I just stopped being able to run or to compete, to be competitive. And so I went to an FAARM conference, and while I was there, one of the small offshoot venues, the little vignettes that they do, was on PEG MGF, which is a derivative of growth hormone. It's what IGF-1 becomes in the face of injury. And so it helps naturally, the MGF, mechanogrowth factor, helps you to recover from injuries. And I was fascinated. Oh my gosh, here's a solution that's better than what I had at the time, which was steroid injections and, ultrasounds, wave kind of things. And those were not effective in most people. So wow, this is terrific. How exciting. Where can I learn about more peptides? Well, there was a bodybuilder in my practice at the time, and he was talking to me about peptides. And he's like, oh yeah, not only is there PEG MGF, but there's also, and he listed all the peptides. And of course, he used them in super physiologic doses, and he used them in for bodybuilding purposes. But I learned a ton from talking to him. He was my first teacher, and is still one of my clients, which I love working with him about that. But went to the basic courses on peptides, did a bunch of my own research, was invited, thankfully, to be part of the faculty for teaching on peptides in both FAARM and SSRP, and was able to participate gratefully in their education programs. And when you teach, you learn a ton so that you can teach it, right? That's how you become so educated, is because you not only have to know it well enough to be able to present to patients, but you have to know it well enough to be able to present to other providers. And so that was the blessing for me. And because of all of that research, that's why the book came out and today.
Awesome. You paused for a second. I don't know if it's on there's a little bit of lag. Maybe it's on my side. So did you like what you talk about is kind of it's a peptide fellowship, right? Like you're, when you go through FAARM, et cetera. Did you also do like functional medicine certification with FAARM or with Institute for Functional Medicine?
Absolutely. So I did it with, I did the fellowship program through FAARM.
So this is always intriguing to me, but what's the internal conversation you have with yourself in terms of, here's what I learned in conventional medicine, and here's all the things I didn't learn, and bridging the gap for yourself and then also your patients, this like disconnect of I have to go out and search and find other things. And now that I have, I'm kind of on the other side. Lexi calls it the bright side, not the dark side of medicine. Like, how do you explain that to yourself? How do you like justify that for again, yourself and your patients?
I think this is what I'm really passionate about right now, is this gap between bench medicine and clinical medicine. There's so much information. I couldn't get over how much information there is out there. If you just start researching, just go to Google Scholar and research any kind of topic, like what's a normal TSH level? What's a normal ALK phos level? What does it mean if ALK phos is abnormal? You know, what are the peptides? Each peptide itself, there's hundreds of journal articles. And who knew? And there are doctors out there, lots and lots and lots of doctors who don't know about them at all. They might know a little bit about the new, semaglutide that's out there, or the CGRP peptides that are out there for migraines. They might know a little bit about those and some about insulin. But they haven't done this amazing research that's out there. So like losartan is a peptide, bacitracin is a peptide. And so people are saying, what's this new peptide thing? Well, it's not a new thing. This has been around since the 1920s. We just are learning more and more and more peptides that are available, but this has been around forever. And of course, they're naturally made by your body. So they've been around since the dawn of humans. And so it's just exciting how much we can learn.
Ta-da! Am I back?
Yes.
Are you
Hello.
ready? I don't know. You were having a lag and then it kicked me off, so it's got to be on my side. Geez, I hope this does not last. Anyway, I think I heard most of it. Yeah, there's information.
So it's
there.
Yeah, it's just the gap of time from when the research comes out from the bench researchers until it comes to the desk of the medical provider, usually brought out by a pharmaceutical rep. And so there's this big lag time between information being available. And so if there's not a way for the pharmaceutical company to feel like they can make money about it, then often it doesn't make it to the table or to the education platform of the medical provider. And this is a real problem because we really want to make sure that we have the latest information. And if I have a patient with MS, I don't want to wait months and months and months to get, or years to get the patient's care to them. So this is where there's sort of this is a big passion for me, is wanting to be able to provide information as quickly as I can to my patients and to provide solutions to their problems, not necessarily waiting until it's passed through all of the different things. Because my patients have usually been through a lot of things before they come to me.
There is a term now for this, like this gap between like when the literature comes out, even if it's current modern day, and the 10, 20, 30 years it might take for medical training and medical implementation to actually catch up. I think that's what you're talking about, is like, but as providers, maybe you could be a little bit more proactive in finding that information, and then pharmacies, et cetera, fall in line too with being able to prescribe and get things and utilize them. Or somehow the public gets a hold of something like GLP-1s and all of a sudden certain peptides anyway are really well known. But you talk about in your book, by the way, this is Dr. Suzanne's book, Counterclockwise, about peptides. It's written for the public. As providers, I think that's the biggest tool you could use, is somebody else's forthright to create material to share with your patients, your clients, get them self-educated, and then come back to you for the actual, guidance and prescription. But you mentioned there that many practitioners don't have the time to do this. It is something that like really takes some, I don't know what it is, self-discipline or a way to set up your practice or something so that you can, really find this information and then learn it well enough to, provide it.
For me, it's easy. I mean, I say easy, it's not easy. It does, as you suggest, it does require self-discipline. So I set up on Google Scholar, I set up alerts. So every day I get an email that it's for right now, and I switch up the alerts. But every day I get an email that has a hormone, because I'm interested in what's going on with lots of different hormones. and one is hormone, one is peptide, one is thymosin, because I'm fascinated by the thymic gland peptides. One is Humanin, because I'm wanting to get whatever new things are coming out about Humanin, the mitochondrial peptide. Anyway, it sends me all the research that comes out the day before on that particular subject.
Oh, I didn't know it could do that.
Yes, it's awesome. So you get emailed links to all the new articles that come out. So I get 5 new links every single day of the different things that I'm curious about, and it will keep me updated. So there's an herb that I think is really exciting and it has a lot of potential out there. And so I'm having it send me articles about that herb every day. Growth hormone, it sends me articles. But I try to read 5 articles every day. That's sort of my self-discipline goal, is to get 5 articles. And when I start getting bored reading the articles, I just switch up the alert to a new thing that I'm curious about. What did I just see? Did I just see a patient with MS? So I'm going to look up, multiple sclerosis, and I'm going to have all the newest articles that come out about multiple sclerosis for the next, couple of weeks.
If you're listening and you didn't know that, that was totally worth attending. That'll save you
Right?
It's almost like using an AI type feature to, really shorten the amount of work you have to put in for something. Before we go any further, I forgot to remind you that use the chat. We want this to be interactive. We're going to go through some questioning and things here, and then at the end we'll answer these questions. So if you have specifics in clinical implementation, etc., but use the chat. I wanted to ask you, read your book. I just was with Lexi U in Indiana, and we were teaching 15 practitioners on regenerative medicine, the injectable side of aesthetics and also the cellular side of regenerative medicine. And I asked them the question, like, what are the causes of aging and how do you describe that to your patients? From a functional regenerative standpoint, what causes this breakdown? Because I think this is so important as to how you think about copper peptide, how you think about thymosin beta 4, how you think about glutathione, how you think about human cellular tissue products, like what causes that breakdown, and how do we explain that to patients so they understand that it's not a drug deficient syndrome that is actually what they're in need of.
Right. So I talk about it like aging is every single cell has DNA. DNA is the sort of blueprint of who you are. All that DNA has all the information that you need to make a baby, to make that baby grow up, to cause the baby to mature into an adult, to cause to also cause everything to begin to decline. So around the age of 35, we begin to spool up that DNA, the younger DNA, onto these little spools. And so it's less accessible. As that DNA gets wound up on these little spools, we have less access to the more youthful genes and youthful things that your body would make, because it's getting overloaded with environmental toxins. That's the sort of simple way to say it. Includes food, includes stress, includes lead in the water, includes mold exposure, blah, all the things that we're exposed to every single day. And so as that happens, our body becomes it's trying to be efficient. It's trying to do the most efficient thing that it can. And so it winds up the more youthful DNA, pushing the cells toward a more aged phenotype or expression of the DNA. So in that, you'll begin to not be able to repair your DNA quite as quickly. You'll not be able to replicate your cells as efficiently. The cells lose their ability to create energy, so the mitochondria don't work as well. They lose their ability not only to create energy, but to use energy efficiently. And then they also lose their ability to make proteins properly. So as a protein comes out of the nucleus and goes through the processing through the Golgi body and the endoplasmic reticulum to make itself, to make the protein, it comes out not made quite right. It's missing a couple of amino acids. So then when it tries to be folded, it doesn't quite fold properly. And so that becomes trash. And that piece of trash now junks everything up. So you don't have the ability to, just imagine us trying to have this conversation and the room is full of boxes. We could still do it, but it would be much more difficult for you to hear me or understand me. And so now things don't happen as efficiently as they used to. They require more energy to do the original task that it was designed to do because it's junked up with trash. You can't get rid of the trash quite as easily. And so all of that accumulates in the aging process. And each of those things sort of happens like a set of dominoes, and it just sort of falls down where the cells aren't able to function anywhere as well as they used to be able to. This also happens in our stem cells and every single organ. Although we think that stem cells come from outside of us, all of our tissues have stem cells to be involved in repair. And so that aging process with the DNA spooling up the more youthful parts of our DNA onto spools, so that they're less accessible, that all of that stuff happens in your stem cells. And so now those stem cells are less able to repair your tissue. So we have this sort of happening everywhere. And even though there's damage, and when you're younger, you're able to repair more quickly, as we age, our ability to repair goes down. And partly it's because our stem cells get used up, they not only get used up, but also they become more aged and less able to do what they're able to do.
So I love that. I think any patient could hear that and say, okay, this is starting to make sense. You even use basic like biology terms we all learned in 6th or 8th grade, right?
Mm-hmm.
And then it leads itself to, but I think a lot of practitioners need to hear ways other people explain it, right? That you have to it's not dumbing it down. It's just using terms and ways and analogies that the patients can understand and get it. But then it leads to this question next of, okay, so what do we need to do? Like what provides the cell or the stem cells more energy or more resources to continue to replicate, divide, so on and so forth in a more healthy and maybe for a longer period of time? And I'm guessing that peptides, human cellular tissue products, they are the answer to that. Some of the answers.
Absolutely. And of course, I'm going to say at the very beginning, you have to be able to do all the things. When you're 20, you can go out and do a binge drink, 6 nights in a row and then run a marathon 3 days later. You can do that. When you're 50 or 40, you can't do that anymore because your body can't recover as quickly from the exposure, from the trauma, et cetera, that it did before. So it's really more critical over the age of 40 that we begin to do things like sleeping regularly, setting aside designated time, putting boundaries around your sleep, putting boundaries around your family time, putting boundaries around your food so that you're making wise choices in the things that you're putting into your body. We need nutritious food. We need to be exercising on a regular basis. Consistency is key with exercise and making sure that you're doing some resistance to maintain your muscle mass. Muscle is giving us all of these beautiful myokines that tell our cells to unspool that DNA, exposing the more youthful DNA. So all of those things are kind of the baseline before we even get to peptides. But yes, that's really helpful.
Yeah, thank you for that too. Obviously, that's what I think is kind of the downside of everybody catching on to these GLP-1s is they're not talking about those things. They're not educating. It's supposed to be a miracle, what do we call it? Something pill. What is it called? Magic pill. Like, geez, magic pill, instantaneous thing. We want to run through the drive-through and lose weight. But not enough people are talking about these things. And you hit on something, you talk about a lot with the myokines. When you're speaking for us in June, I heard you say it at ACAM years ago too, like muscle is the currency to aging. And maybe I was late to the party, but that was the first time I had heard that. I've heard telomeres, we talked about, so many components, but what is it about myokines that are so relevant to how and when we age?
Yeah, I will give the credit for that quotation to my dear friend Carl Lenore. He's the podcaster. If you haven't listened to him, I love him. He's dear. But the concept is the more muscle mass you are able to maintain as you age, the better you will age. And there are lots of obvious reasons for that. Your falls are less likely. You have more reserves if you do end up having to have surgery or having to, becoming sick from some sort of viral illness or whatever. Your reserves are there that you wouldn't have otherwise. So you can get up from a hip fracture if you're an elderly person, you're less likely to have a hip fracture in the first place if you're doing resistance exercise, etc. But the exercising muscle produces these beautiful myokines. There's one called irisin, is probably the most famous one. And these tell your DNA to behave in a more youthful manner. And so, or to express more youthful proteins, peptides. And so your body, it decreases the inflammation that goes on. And especially we accumulate more inflammation as we age. So the myokines decrease inflammation. They cause you to, liver functions more optimally. You're burning fat as a fuel. Fat is so much more efficient than sugar as a fuel substrate. So for your cells to make energy or to make ATP, it's so much more efficient. So myokines help with improving the way that cells are able to create that energy in a much more efficient manner. They are the balm of youth. And so I'm a big fan of resistance training because of its benefits in the obvious, but also the less obvious, which is the myokine communication with the rest of the body.
So it just reminds me, and we've talked about this in previous webinars. We don't have to go down this rabbit hole, but this is why it's so frustrating to me that people are putting patients or people who call in and want to shop for $197 on these weight loss peptides that will by default decrease their muscle mass. It's
Yes.
like, we know metabolic health is so important, right? You got to be a healthy weight. But when you lose muscle as part of that, you're now, it's a double-edged sword, I guess, if that's the right term. Like, it's gotta come together. And I think that's why we see the hair loss. And that's why people are not well, even though they are finally at maybe a more healthy weight. It's so frustrating to me. I'm sure it is even more for you.
I would hope that I would hope that your providers would be using a bioimpedance analysis or a DexaFit or whatever it is that you need to be using to help be sure that you're monitoring, because you're going to actually have some more positive results with your clients if you're monitoring their muscle mass. What I mean is, you might not see weight change, pounds on the scale change, but you might see fat loss in their BIA. So this is the thing that we use as part of our practice for our patients, is monitoring their BIA, their bioimpedance analysis, which tells us what their muscle mass is, what their fat mass is. So we know that even though they may not have lost pounds, they are losing fat mass, and that's what our goal is to lose fat mass. These GLP-1s are super effective at that. That's what their goal is. So it's so what we do
at her office.
Yeah, I think they're super helpful. And so we make our clients do it once a month. They come in once a month. And the bargain that we strike with them is that if they're losing muscle mass 2 months in a row, we will not continue to prescribe it for them. That we have to do something different for a while. So this is their motivation. And so to get into the gym, do some sort of weight training, and to increase their protein intake. What's curious is there was a fascinating study that came out fairly recently, and I'll give the credit to Dr. Bill Campbell, who is a PhD in Florida, I believe. I forget where he's located, but he put up this study where the women trained athletes increased their intake of protein by 300 calories a day. Don't quote me on that. It's something like that. They increased their total caloric intake by 300 calories a day, but those 300 calories were protein only. And these women lost weight. So for all my women out there, this is my big, soapbox, is we've got to increase the amount of protein that we're taking. And they think, oh, I can't eat any more calories. I have to decrease my calories. I have to shrink down to nothing and take nothing in. This is so bad for your body. It's so terrible for you. So please make sure that you're taking in adequate protein calories. And when we look at your bioimpedance analysis, your provider should be able to tell you what your protein calories should be based on your lean body mass.
The caveat to everybody listening, you've got to get a device that helps women especially realize that if I gain weight or I don't lose what I want, but you're doing the things that you should, that it's an exchange of muscle for fat. And that will help you. I love too that you're kind of like withholding your treatment if they don't do what they're supposed to do. Like maybe that sounds a little bit funky, but I also think, it'll help you find those people that want to do it well. And you just know you can be your best practitioner self if you're helping them analyze this correctly. So back to this question of like, how do you explain aging, et cetera, and muscle being one of those components, but do you attract patients only who like want to defy aging, who already, look at biohacking or like, do you have to also help them understand the tools and mechanisms that you have? Because a lot of them are not insurance based, right? A lot of this is lifestyle education. And, how do you transition into, I've got a whole repertoire of things, but it's stuff you may not have heard of, you might have to pay out of pocket, or do you have patients lined up at your door who already want to do that?
So it's a little bit of both. We have sort of two categories of patients. I have one category of like entrepreneur, biohacker. We want to do peptides. I know all about it. We've heard you on podcasts and we want you to be our doctor. And then I have another category of patient that's like Lyme disease, mold, toxicity, MS, sick patients who want to get well from wherever they are. So sort of two categories of patients. And so in those patients, that's where I'm often putting my toe in the water saying, look, I have a therapy that is available to you, peptide therapy that's available to you. I go into what is a peptide. It's, look at insulin is the most famous one. Bacitracin is a peptide as well. They've been around for a long time. All the things I said a few minutes ago. And then I'll say, this is available by injection. I know most people don't like injections, but you'll do your first one here in the office. And I promise you, it's the tiniest needle that's ever been put in your body. You won't, you'll barely feel it. I do 3 of them almost every day. So you're going to not even notice it. And we'll start with that. And it depends on what they're looking for, what their hopes are. There's some really fascinating research on using the GLP-1s, but let's say that you're not responding to a GLP-1, using something like a growth hormone secretagogue can sensitize your GLP-1 receptors so that the GLP-1 then works. So a lot of times if I have those patients who are non-responders to the GLP-1s, I'll have them stop for a month. They'll go on a growth hormone secretagogue. They'll start some resistance exercise. They'll change their diet a little bit. And then we go back to the GLP-1 a month later and look at that. Lo and behold, it works.
Ta-da. Done.
Yeah.
So so this is one of the challenges, obviously, with providers is there are far more peptides than just the ones that the public knows about. And even what you probably learned is, basic peptides, maybe in terms of medical school or what those more famous ones are. So what do you feel is the best tool? Like, what would your, hint be to providers who are new to this, but need to figure out better, like how to utilize, because they're so overlapping in so many ways. This is something I struggle with too, is like, why would you use that one? How would you use that one? If we can't get that one now, how do we do this with it? So like, what are the tips that you have for providers on being better at knowing them, understanding them, and prescribing them?
Of course, I think any of the fellowship programs are really super valuable. And I know for sure that FAARM is modifying their lecture. Their entire curriculum is being modified to bring in the new peptides that are available. This is super exciting for us because we have lots of opportunity for growth and learning. We've been stagnant with these same 20 or 30 peptides for, the last 10 years. And it's super exciting to have the opportunity to go not only look at some old peptides that we did not use before as much, but also to be able to research new ones that are out there. One of the cool things is I can go to some of the compounding pharmacists and say, hey, can you make for me some blah, blah, blah? Because I read 17 articles about how great it is. And so it makes us be more creative. It makes us be more curious, and it makes us do more research, which I am fascinated and thrilled about. So it's an opportunity. It's as frustrating as we may have initially felt for the decision by the FDA to not allow them to be compounded. We are excited keeping in mind, even though the FDA said they were not allowed to be compounded, they did not do that because they were unsafe or because they were ineffective. And I'll leave that right there.
I think
They
also
did not.
when I was talking to you earlier, some of the creativity that you have to implore is which pharmacies, several pharmacies, learning more about what's available. You were like, I think this pharmacy has this one. I think this pharmacy has this one. And unfortunately, that's the nature of the game. It seems like today is you have to expand your resources. There's got to be some diversity there.
Yes. So I have one of my medical assistants is her entire job is the peptide program. So she keeps track of the entire what's available from all of the compounding pharmacies. And we probably have, I don't know, 10 or 12 compounding pharmacies on our profile. We have, accounts with all of them, and we'll get one peptide consistently from this group. No one makes in the US makes thymosin alpha 1 anymore or cerebrolysin. So we get those from a group called Global Provider Alliance. That is a physicians group, and we get them through them. They are legal in the United States to get those two peptides through Global Provider Alliance. It's awesome. Thankfully, Larry out of Florida has come up with this legal way for us to access those peptides. But otherwise, you get this one peptide from this compounding pharmacy and this other peptide from this. And we're also trying to find the best price for our patients. We want to give them the best opportunity and the best price if we can. And so we'll shop them around not only for the availability, but also for price, because we want to make sure our patients, I want them to get the best care, but I also want them to be able to, let's say it's a $50 difference in price. Well, that might be one more peptide they can afford in their stack, as opposed to just being able to afford one. Now they can maybe afford two, or, 2 or 3 or whatever instead.
Love that. It's also a game we're playing between price and quality and sourcing.
Yes.
Jesse and I put together last weekend a list of resources, or we call them vendors and sponsors, but really it's just like, here's some companies that we know create some good stuff. Like one of them we'll talk about is your affiliated aesthetic product. But Vicky's actually got that link. She can share it in our chat. Again, it's a lot of things that Lexi and I had last weekend, and I haven't added all of these to it that you're talking about, Suzanne, but we'll have to go back and do that. So it's like just quick link, go over, fill out the paperwork. And so we're trying to make those resources more in like put them in front of you better. And then you don't have to do so much homework to find out who's got what. Cause it is almost like a full-time job. Okay. I wanted to ask you, like, what inspired you to write your book in terms of, I love it because you talk about like it's a handbook. I mean, in the beginning, you're like, here's some basic functions that we need to understand, basic, I think ways that we age, where does the energy go as we age? But then you really like break it down by immunity, neuroprotective, cardiovascular, beauty. And it's really is like you can pull up any chapter and say, okay, what are the peptides? And there's like a paragraph on these peptides. So we're educating patients. This is written for patients. But at the same time, you're kind of giving a brief rundown of why patients would need it. So how come you decided to go that route versus some of the other offerings? You speak to so many different providers, and you probably have this conversation with your patients all day, every day. But what was inspiring to you for that format for your book?
The things that are out there right now, the other books that are out there right now are really definitely designed to be read by providers. And they are encyclopedia reference type books. What wasn't out there was there's a difference in dosing for women. There's a different, our bodies process things differently. There's a difference in that. And there's a difference in stacks. There's a difference, there are things like infertility, PCOS, endometriosis, for which I would use peptides that are not mentioned in the general, those main sort of peptide textbooks. And so I wanted to provide something, most of my patients are very smart. My biohacking patients, super smart. And I wanted to provide something for them that would give them access to that information so that they can come to their doctor and say, because the majority of patients aren't going to have a doctor who knows. There's only 800 of us or so that know anything about peptides
Is
in the
it
United
really
States.
that low?
I don't know. I'm guessing. That was a guess.
Wow.
But
Wow.
it's low. Out of hundreds of thousands of doctors in the United States, there's only a few of us that really know about peptides. So most of the biohackers are going to go to their doctor who's not going to know about it. So, and their doctor's probably going to know that they're the biohacker kind of person. So they're going to go to their doctor and say, hey, will you prescribe me this? Here's the references. So there's journal article references in there for your provider, so that you can go to them and say, hey, will you consider prescribing this? Or will you at least go and learn something about this? Maybe you'll go to a conference with FAARM. Maybe you'll, whatever the thing is, if you're interested in learning, maybe you'll read this book. So it really is also designed for providers to be able to communicate with their patients better. So if you read the vignettes, if you read the stacks that are there, if you read those things as a provider, you'll be able to hopefully communicate with your patients about peptides and about specific peptides in a more efficient way. So it's the goal was to provide an accessible piece of information for patients who are not medical, for providers who are not peptide knowledgeable, and also to provide the science, some of the science behind what is available out there, maybe to pique some curiosity and looking into what else might be out there as far as research.
Again, I think that that's such a tool for providers. I've been using it forever. It's just, you're also speaking. I got this, actually it came from a friend of mine who's listening. Hey, there's a peptide forum or whatever they call it, a virtual thing for the public. You're actually one of the speakers on it. And
Yes.
It's like, you guys don't have to be the ones putting all this information out there. Other people have done it gratefully, like Suzanne. Find those things and share those with your patients. It'll help educate them, educate you along the way, and then they bring that back to you. And it's like, it means that the conversation in your office is truncated and a little bit more focused on actually like getting to the problem and prescribing and getting them well on their way versus all this time educating. So like, find these tools and use them. It's fantastic. It's really, I don't know. I think it's it leaves a mark, it's a legacy to those who have done the work and you then took the time to publish it and get it out there. So appreciate that for sure. Like I say, I've told everybody about it. I'm like, because I talk about peptides and people are like, oh yeah, well, I had to go this morning to the lab. I was texting Lexi about this and I just had to have a regular blood draw. And I just went to Express Labs and I haven't been in a regular mainstream place in quite some time. And in fact, I was just in Lexi's office for 2 days where it's just like, it's so different and you feel like you're with your people. And I'm just in the lab, just going to get a blood draw. And I was like, I am so shocked by what healthcare professionals look like. It has nothing to do with what health should look like. But two, I thought, here I am. They know nothing about me, obviously. But the irony here is that they know nothing about what we do. Like conventional medicine really knows nothing about what we do. And if you said, hey, have you heard of peptides? Have you heard of ozone? Have you heard of, now people are getting familiar with IV bars, but mainstream medicine knows nothing, like they've never even heard of it. And so it's a great route, I think, to educate the public, and then maybe that can motivate. We hear all the time from ozone doctors, how'd you hear about it? I had a patient that came to me and asked for it. And so, you get enough of that and you definitely will be motivated to learn more about it, especially when there's great results. So I wanted to ask you, in your memory real quick, like what's the most impactful result from peptides? And I know you don't just do peptides, but like a patient case where like the peptide was the turning point or was the pinnacle.
Boy, probably the most important one was a kid we treated. He was 16 years old when we saw him the first time. He was hypogonadotropic hypogonadism. So no brain production of FSH, LH, no gonadotropin, nothing, he wasn't doing anything. And he had really long arms and legs because his growth plates hadn't closed yet. He had no facial hair. He was very feminized. A little bit of gynecomastia, very, tiny phallus. he had no hair growth under his arms or in his inguinal area. He sort of high-pitched voice, was a bisexual, according to, you know, him and his mom. So the complicated thing with that was his parents were divorced. So I had to bring them both into the office to consent them because he was underage. And mom brought him to me because she'd heard about peptide, already been to several endocrinologists and a geneticist who said, too bad, there's nothing you can do. He just needs to go on testosterone therapy. See you later. And we said, hey, she came to me and said, I heard about peptides. Will you please talk to me about what's available and what's possible? So we actually put him on kisspeptin, which I think is one of the no compounding peptides. But anyway, we put him on kisspeptin. The difference, I mean, this kid, I'm telling you, he came back, he'd put on muscle, his growth plates had closed, he had developed his phallus, he had some facial hair growth, he had deepened his voice, he was so confident. I mean, this was such a different young man than the one who walked in my door, you know, 6 months before. It was a dramatic difference in his care. He did still require some testosterone therapy because the kisspeptin did some, but it didn't do quite enough. And so we added testosterone therapy with an HCG in the interim. There's two big journal articles that talk about this. In this particular patient, there were protocols for this particular patient. And I think the articles were like 16 patients or 10 patients or something, not a huge number, but there were two articles with this same protocol. And so we did kisspeptin, but we added low dose testosterone with every 2 months break, every 3 months break, and giving him HCG in the interim. So the downside of that story is, and he stayed our patient for another year and then was lost to care after that. I'm sure that he just went to testosterone alone. But the downside of that story is his endocrinologist reported me to the Georgia Medical Board. Yeah. So this is something you need to have a conversation with your patients about. This is part of the conversation, the education conversation. Look, your other providers aren't going to know what this is. They're not going to have any idea what this is. They will never have heard of it. So it's okay with me if you mention it to them, but you have to know they're not going to know what this is. So, you know, do with that information what you will. And let's, you know, be judicious in how we use it. Now, it was fine. The medical board didn't have any problem with it. I got released because I had all the documentation where I had spoken to the patient and said, this is not FDA approved. There are, you know, minimal human studies. Most of the research is done in animals, but the patient and family members wish to proceed. They'd signed all the consent forms. Both the father and the mother had signed the consent form. So that was, you know, and I documented, you know, 30-minute conversation with mom and dad present, explaining the pathophysiology of hypogonadotropic hypogonadism, blah, 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 blah. So, yeah.
Wow. Fascinating though, how one of your greatest results turned into it had a twist to it. I don't think of it that way. I think of like treating kids with oncology or, you know, like a pediatric, you know, just pregnancy. There's certain things in medicine where you're just like, yeah, you definitely want to make sure you dot your I's and cross your T's. I wouldn't have thought about it in terms of, was it because he was a minor or was it because peptides are non-FDA approved?
Did the guy report me to the board?
Yeah, like was the case about him being a minor or was the case about how you used peptides?
Because I use peptides, which are non-FDA approved.
Yeah, fascinating.
Yep.
But I love too,
and so
like, I couldn't touch it when you have all of your crap in line.
Yeah, when we have several infertility cases where the patients were able to get pregnant after we treated them with growth hormone secretagogues, and you know, we did other things too. We did LDN and we did you know, thyroid management. We did a lot of other things too, but the peptides were a big part of that, of their being able to get pregnant. So those are all exciting, fun stories too. The MS patients that get better, that, you know, we use dihexa, and it's the only thing that gets her functioning. And now she's able to go back to work. She hasn't worked in 20 years and has been on Medicaid, and now she's able to go back to work. So that's exciting.
And in your book, you talk about a lot more of these stories too, just women there. I feel like it was geared a lot towards women and women's health, and women's mindsets and women's lifestyles. I don't think you came out and said that, but I did feel like there was a presence there. But you do share some of these stories, women that really were like almost on death's door, and how they became, you know, not only did their faculties come back and they had a good quality of life, but they were able to become active again. Something that hit me so hard was you were like, I almost recommend and treat athletes the same as I do elderly. Like they have the same energetic needs. And it was like, I feel like so many people just say, hey, I'm aging, I'm done. This is what aging looks like. And yet, if you think about their like nutritional and energy, I mean, like mitochondria, so on and so forth, that they have the same, you treat them about the same. Is like such a way of saying it, just hit me hard.
Just realize that people who are, especially elite athletes who are really trained, and I don't just mean elite athletes, NFL or whatever, but people who are professional, yes, but who are training hard on a consistent basis, their oxidative stress level is much like a 70-year-old in some cases. So just because of the strain of the activity on the body, you know, the 2 workouts a day and 2 or 3 hours a day and whatever it is that you're doing to train, your training would require, it's quite taxing on the body, just like it would be if you were 80 years old. So we treat them very similarly, and their nutritional needs are similar, and their recovery needs are similar. And so you just think about them very similarly.
So last question on peptides. I wanted to touch on human cellular tissue products or advanced biologics for a minute too, because I know you do those. But today, what would you say are the top like 5 most used peptides, injectable peptides that you're recommending?
So I'm a big fan of oxytocin. That has been my new favorite peptide for bodybuilding, for body composition, both fat loss, muscle building, bone. We use it a lot in our patients with osteoporosis. And so I'm a big fan of oxytocin, also for sleep and general stress and anxiety. It's a great one for that. So for lots of different reasons, I'm a huge fan of oxytocin. You said injectable, but I really like VIP nasal spray. I like VIP for a couple of reasons. I like it for intestinal motility, for lots of intestinal problems, whatever you may have, if you're having sort of IBS-C or other intestinal related problems. I like it for patients who have insomnia. Of course, we use it in our Lyme and mold disease SIRS patients. We use intranasal VIP as part of their protocol, as part of the end of their protocol, to recover their circadian rhythm. Anybody with, you know, jet lag or other circadian rhythm disorders will use VIP in. Let's see what else we're using fairly consistently. Of course, we use the GLP-1s a lot. We use the GLP-1s a lot for our heart disease patients, and that's been really, there's a lot of research out there on using those. I like tesamorelin, which is a little bit harder to get, but it is available. And I like tesamorelin for our heart disease patients too, especially congestive heart failure kind of patients. It's a little bit more difficult to find CJC and ipamorelin right now. And there is some interesting research with ipamorelin and congestive heart failure or heart failure situations. So those are a really popular one.
And you said you have a special interest in the thymosin.
Yes. So I love thymosin alpha-1, and I'm so grateful that we're able to get it through Global Provider Alliance. And that one I use a ton in any of the inflammatory conditions. So osteoarthritis, Hashimoto, MS, any of those inflammatory conditions, we're going to use that. I use it a lot in sort of the viral syndromes that we've seen in the last couple of years. And we use that for helping. What we see right now a lot of is patients are getting their immune system is really shifting over to the antibody making side of their immune system. And so their lymphocyte count, we just simply will check a lymphocyte level. Lymphocyte counts under 35 are where we're really at risk for illness from any new viruses or cancers that might come up. And so I'd shoot for a lymphocyte count of 35 or greater. One of the ways we can correct that is with using thymosin alpha 1. And so we'll do that twice a week for 3 or 4 months. And then we'll see that lymphocyte count come back up. So now they're more in balance and better able to fight off viruses and cancers.
Fantastic. And I lied, one more question, because I think it was Doug who asked this question, but you mentioned interest in Humanin. Is that how you say
Yes.
it? Humanin. On Google
Yes.
Scholar, would love to hear your thoughts on Humanin versus MOTS-C as it pertains to most beneficial MDP. If you had to pick one, considering costs, what would you?
So my very favorite mitochondrial peptide is SS31. Thank you, Lexi. It's my favorite. I think it's the most effective. I see it the best. It works great in heart disease. It works great in kidney failure. And I have a guy with IgA nephropathy that I just put on thymosin alpha 1 and SS31. That guy's kidneys are doing great. He's also on rapamycin and pentasan, so a bunch of things. But I think of those, my favorite is the SS31. It's just super expensive. And I think the MOTS-C is a little more difficult to find right now. Humanin is a little bit easier to find. And I have not fallen confidently on a dose to use. So that's why if I am guarded in talking about Humanin, that's why it's in my research pile, is because I want to know what is the standard dose. I use an article that I just looked up this article, and I use it all the time. If you've ever attended my lectures, I almost always put the slide up. That's the human equivalent dose slide. So you can look at what if the study was done with rats or mice or gerbils or whatever. You can look up the human equivalent dose. There's a chart that shows you what's the expected.
That should be helpful. Makes sense.
Mm-hmm. There are, like I said, there's probably 12 peptide pharmacies. I'm just answering that question was asked. Yeah. There's probably 12 that we use. I use Pure. I use South Lake. I use, I think it's called, I use New BioAge for sure. Those are probably my number 1, 2, and 3. Then I use.
Two of those are in that reference list, that resource list that Vicky put in. There's a link. And so if you click on their logo, Pure is in there and New BioAge is in there. If you click, it'll either take you to their paperwork or a contact or their website. So you don't have to remember what she's saying. The South Lake we don't have on there. I'll have to look into that. And the Global Health Care Alliance, is that what it was?
Global Provider Alliance.
Global Provider. You told me it's on. I wrote it in my notes too. Okay.
And you can get cerebrolysine and thymosin alpha from them.
You mentioned Premier when we were talking.
Yes, they're in Florida. I'm in Miami. And the pharmacist is the nicest guy. I really enjoyed meeting him a couple months ago while I was in Miami. That was a great exposure. PD Labs does a bunch of peptides. Okay. Yeah, they're down in Texas, right? We use the wells in Texas. We have a few patients who live in Texas, so we use the wells in Texas. I'm trying to think of who else we use. Olympia, Verticis. They have a few. Empower doesn't have
about everything. We're talking about oral, nasal, and injectables.
Yes.
Across the board.
Empower doesn't have very many anymore peptides. Texas Star we use.
Yeah, I was going to mention that. That's why I asked. They don't do a lot of injectables, but they do have some other things. Mm-hmm. By the way, in our peptide class, June 7th and 8th, Leonard from New BioAge is going to be speaking on alternatives to peptides.
He's great.
I think you have to, like, when all these laws hit, etc., or these changes started to become more predominant, he really went to work because so much of his pharmacy, his business was based around peptides. So he really went to work to find alternatives. I know Lexi was talking last weekend a lot about like LDN, other things that you could use to trigger those same pathways in patients to get similar results. So he'll be lecturing on metabolic and GLP-1s in terms of longevity, but alternatives to peptides. He's fantastic. And if you go to New BioAge, become a member, he's got a huge education platform to help you learn this stuff also. We have our peptide thing, which is more the clinical application or implementation in terms of performance, in terms of gut. Lexi's talking on gut, Doug's talking on what do we call it, gut? Doug, you even just said it, body composition. But that'll be more, again, the clinical implementation. Leonard's one of those guys that does have really good information on the pharmaceutical, which would be kind of the biochemistry side of it, right? So anyway, we try to provide these resources because we know that that's a big element to this. Well, it's been an hour, but at the same time, we didn't talk about
Vitality.
Yes. Oh, and Vitality. Yes, let's talk about that. So love this story. You have some patients who really got great results with you, and I'm sure hormones and everything else you do, but with peptides. And so they were so inspired, had business and entrepreneurial experience. I'm stealing your thunder, but and so they developed a beauty product, a topical copper peptide product. I reached out to them. They sent it to me. I've been using it a couple of weeks. Fascinating, because I already had one that said copper peptide, and she said to me, well, is it blue? And I said, no. And she's like, then I don't think it's got copper peptide in it. So anyway, yours is 2 to 3%. I don't know, tell us about it. I have loved it.
Oh yeah, it's great. So there's a medical grade serum that's 3%. There is an eye cream that has brown seaweed in it, and this really helps with hydration and helps with the absorption of the copper peptide into the cells, into the fibroblasts. And then then there's a moisturizer, a body cream. I'm a huge fan. They have several other products in their line that are not copper peptide related, but I'm a huge fan of all of their products. And what she originally said was, wow, it's fixed my crepey skin. And I think that's what I really see the difference, is that crepey skin being resolved with using the copper peptide. I do use a derma roller, or sorry, a derma stamp with it about once a week, just to make sure I'm getting access to the rest. But on a daily basis, I'll use just a washcloth for exfoliating and the copper peptide products. So I'm a big fan of them.
So were they somebody who just kind of wanted to throw their hat in the ring because they were inspired and had the means to do it? Or did you guys, because you're kind of their medical director, medical oversight, or just knowledge, is there something with what they do that's different? And again, Lexi's got some great products. I'm sure people listening have some great products, but is it different than some of those professional grade copper peptide products you can get?
Yep. So it is effectively the same percentage of GHKCU in the product, but because of how she has it formulated, and this is Debbie, is she, the owner of the company, because of how she has it formulated, it accesses the cells much more efficiently and improves hydration of the skin. So you're getting a synergistic product that has several different ingredients that are involved in hydration and rejuvenation, youthfulness of the skin.
And the thing too, from what I know, I'm not an expert on this, but the other products that make up creams and oils and stuff are also very clean. I mean, it's a very
super
short
clean.
That's always a thing for me. It's like, great if you add glutathione, great if you add vitamin C, great if you add copper peptide, but or ozone even, what is the other stuff in it? And they're so easy to use. I love it's weird. It's almost like I don't know what the consistency is. It sprays out like it's going to be very almost like water, just very liquid state, but it holds together. It like binds together and you don't waste it. It stays in your fingers.
The serum. Yep.
Yeah, the serum. It's awesome because, again, it's not cheap and you want to put all of it where it goes. And it's got this consistency and that's the thing. I don't have super sensitive skin, but how heavy or light or et cetera these creams are. And if you want to get into aesthetics, you know, the actual injections, and you guys do that too. You do that as well, don't you, Suzanne?
Not as much as Lexi. Yeah, that's not our primary focus. We do
Oh,
a
you
little
know,
bit.
okay.
We do hair, and we do penis and vagina shots.
Okay. Well, I think I'm going to save the human cellular tissue products for another time. It seems like too much to shift and a lot to go into, and we've spent so much time on this, but I last thing, like, you use these yourself and you've had such great results and you are such a great image of health. You shared your running story. Have you also had personal successes with peptides using some of the others?
Yes. So I switched when I was trying to recover from my running injury. I switched to powerlifting. So that's been my sport for the last 5 years. It's been really fun. And I'm getting ready to do my third competition. My first two, I placed first. So I attribute a lot of that to my use of peptides in the interim. And, you know, of course, the rest of my lifestyle, making a priority of sleep, all the things we talked about at the very beginning.
By the way, this book, I've not seen or heard anybody else go into depth with this, except my own personal practitioner. But what you talk about in here is like, are you a runner, a long distance? Are you a power lifter? Are you somewhere in between? Like, you actually have protocols, so to speak. Do it before activity, during activity, after activity. You know, when in your training months, in your building months, like, you actually break down that athletic performance in your book, and the stacking and the timing of it's a little bit different.
Yes. Yeah, that's the goal. Is we just have to realize that you may have a different goal. If you're a long distance runner, you have a different goal than I do as a power lifter. I'm not trying to endurance. I just have to lift really heavy one time. So we have very different intentions, and so there are different peptide stacks based on what your physical goals are.
Well, I couldn't agree more. It's just so hard to find practitioners who will recognize somebody who wants to feel so good for so much longer than everybody else. It's like, there's nothing wrong with you. Why are you seeing me? It's because I want to make sure there's nothing wrong with me for a lot longer. And then
Exactly.
having a practitioner who says, I was talking about this all last week, and is just like, sometimes we have to do some rehab work with patients, but once they get to where they're doing well, their care is not over. It's like, now we want to extend that goodness as long as possible. And you can bridge the gap on both chronic disease and regenerative medicine. Whatever type of practice you have, whatever type of patient base you have, you can use these same tools effectively. And so again, I just so appreciate you for the work that you've done, for the work that you're doing, for sharing all of this with us, writing books, speaking of the public, speaking of practitioners, and speaking for us in June.
Thanks, Kim. I'm super excited about that. That's going to be a great event.
Hey, if you guys will hang on with me, I wanted to share really quick this slide because it will give you the code to register for that. We have an early bird special. So it's $50 off instead of $750 it's a 2-day live presentation of, again, practical implementation of peptides and human cellular products. I can't talk and work at the same time, apparently. And I want to give you that code so that you can get that pricing. Let's say play from current slide. Now we've got to share. Sorry, I need a peptide for that. Here it is. You can scan this code. It'll take you to our landing page. It'll explain all the things you're going to learn. Again, it's live. So after every presentation, you have the chance to do a Q&A with the presenters. We've been doing these webinars along the way to kind of front load this so you can get it, you know, introduced to our speakers, introduced to topics. It doesn't matter if you've been using peptides for 10 years like Dr. Ferree, or you're brand new to them and you've got to dive in somewhere at some point. So we've got several of these speakers here, but also we'll be getting to the legality. So Jeff Cohen, as an attorney, is pretty big in our network and circle. So maybe you've seen and heard of him, but he's going to be talking, and then the marketing side as well. So again, it's June 7th and 8th. It will be live. You can ask those Q&As, hear those practical implementation from practicing providers, and it also will be recorded. If you can't be there, you can still purchase it and get the recordings. Here's the code. It's $50 off through the 12th. And if you're a member of ours, you can get an additional 10 or 20% off, depending on what tier of membership you have. So I'll leave that up there for a second, so that you can scan that and get where you need to go. But thank you for joining us. Thank you for your interest. Thank you so much, Suzanne. Really appreciate your time.
It's my pleasure. And I hope to see everybody at ACAM in 2 weeks. Don't forget,
yes.
MedMasters 30% off.
Yeah, here it is. You can scan that code also. I forgot. Thank you. What are you speaking on there?
Longevity.
Is this, maybe this is, no, this is what they said. You're speaking on peptide use for longevity?
Yes.
And we were talking and you said a lot of the speakers are the same, and you said that they're just phenomenal. You were there last year and said it was a really great conference.
Yes, there are several really great speakers. I heard a guy talk about cannabis. That was awesome. He was so smart, and really made it accessible to me. So I just haven't even put my toes in there because it feels like too much, with everything else I'm doing. It's the next thing. So it was really, it was a launch pad for me to start doing more research on my own on cannabis.
Fantastic. Yeah. Take advantage of that. Again, 30% off of the 2-day. It's a 2-day conference with a pre-conference on chelation. I don't know if they still have room for chelation, but they've been the chelation experts. That's kind of been their foundation for 50 years, but obviously they bring in other topics and speakers, great vendors. Avi Herskowitz, a friend of all of ours, is their leader, and they really wanted to go out with the bang, so to speak, on this 50th anniversary. So they've been generous to give us this offer for you guys. So again, 2 conferences you want to take advantage of, virtual, and then Dallas is super easy to get into. You can see Suzanne and Lexi and Doug and many others at both of those. So, all right, y'all, enjoy your
Thank you, Kim.
Thank you so much. It was such a pleasure.
Appreciate you so much. Take care.
Bye.